You're watching iWitness, the Print's daily live feature covering the coronavirus pandemic. The Print's reporters are on the ground across the country, telling us from every state what's going on. And today I'm joined with Moushumi Gupta, who's in Uttar Pradesh in Ayodhya. Moushumi, tell me exactly where you are. I can see a mandir in the background, but can you
Uh,
explain to me where your location is and
yeah,
what the situation is like in Ayodhya?
Jyoti, I am standing in Hanuman right now. You can see the Hanuman temple behind me. This
Yeah.
is one of the important temples in Ayodhya. We see huge footfalls, huge number of pilgrims coming on normal days. But today, like you can see, it's completely empty. Not
Yeah.
only because there is a lockdown, but this is one of the strategies that the district administration adopted when corona cases started, COVID cases started rising in UP and in Ayodhya. So what they did was they went and they took out this uh, circular notice that all temples will be shut down. All temples will be shut down till further notice. So Ayodhya, which is dotted with temples, all the temples have been shut down since Ram Navami. So, I mean, there are no visitors, no pilgrimages, which is how it has managed to check COVID as of now.
So, Maushami, that sounds like a very intelligent thing to do. But tell me, you mentioned Ram Navami. So, during Ram Navami, which just ended a few days ago, were the temples open during Ram Navami, or even during that period they were shut?
No, no, they were shut just before Ram Navami started. So, I mean, before Ram Navami started, they shut it and it's going on till now, and they would be closed till further orders. So, I just interviewed the DM of Ayodhya, Mr. Anup Jha. So, he said that I mean, they had thought of this strategy last year when COVID-19, the pandemic first hit India. So, at that time, they had decided that unless and until they shut the temples, there is no way they are going to regulate the people coming from outside into the city. Last time, and he said that last time when they decided that they will shut the temple during Ram Navami, they faced huge opposition. But nonetheless, they convinced the saints who are here and managed to shut the temple. So this time, when they decided it, they didn't face that kind of a resistance. Uh, what he said was why this was needed was, like I told you earlier, on an average per day, some 15,000 pilgrims come to Ayodhya to visit the temples. And on Ram Navami, on Saturdays, Sundays, the number of pilgrims goes up to 1 lakh. So he said that unless and until the temples were shut, there's no way, I mean, they would have managed to control the situation.
That's huge foresight on the part of the district magistrate, Mr. Anup Jha. Maushami, please congratulate him from all of us. I wish that when the decision to hold the Kumbh Mela was taken, that people like Mr. Anup Jha should have been also spoken to. But you have a question for you, Maushami, from one of our viewers. Her name is Sonia, and she's asking, what is the condition of the hospitals in Ayodhya? Have you been to any of the hospitals yet, Maushami?
Yeah, I went to the main government hospital here, Jyoti. It's called the Darshan Medical College, and there is a district hospital also here. So, in the main medical college, which has been turned into a COVID hospital. So right now they have 200 beds there, and right now 117 beds are full with COVID patients.
This is
So
a
they
private
still
hospital, or is it
no no is the biggest government hospital in Ayodhya,
okay?
the government hospital in Ayodhya. So it has some 200 beds, out of which 117 beds are full as of today. And Jyoti, also let me tell you that in the last 24 hours, Ayodhya saw a total of 172 new COVID cases, but there were no deaths. So no deaths, 172 total COVID cases. So
So
Mr. Jha also told me, and the hospital authorities also told me that right now, I mean, they don't have a shortage of bed, neither do they have a shortage of oxygen in the hospitals, in the government hospitals. So right now they are okay, they are managing it. But if the numbers rise, then they would be in a sticky situation. And that is why they are going around monitoring the situation, reviewing the situation, taking steps in advance to ensure that the numbers don't spike.
So a couple of questions from me, Moushumi. The first is that you said that they have 117 beds which are occupied. So are you saying then that they have testing kits? How is what is the number of tests being carried out? Do you think it's enough?
So right now they are carrying out per day, they are carrying out around 2,500 to 3,000 tests, of which 40 to 50% is RT-PCR test. So what happens is when a person tests positive, and if he's found to be, if the person is found to be carrying mild symptoms, he is given a corona kit. So the corona kit is given by the district administration itself, and the kit has medicines, basic medicines like paracetamol, zinc tablets, vitamin C, vitamin D tablets. So that is given to the patient, and they are asked to go home and isolate. In case of people with moderate or severe symptoms, then they are referred to the government hospital here, where they get admitted.
Okay. And what about the situation of oxygen? Somnath is asking, Moushumi, is there enough oxygen, first of all, and is it equally distributed in all the places in UP that you have traveled so far? You were in Lucknow, I know that yesterday. So what is the situation here in Ayodhya as well as in Lucknow?
Jyoti, I've been here since morning today, and I went to the government hospitals and the couple of small private hospitals that dots this temple city. I didn't see that kind of, rush for oxygen, that kind of, like we keep seeing in Lucknow and the other cities like Allahabad and Kanpur, people running for, oxygen cylinders. I didn't see that in any of the government hospitals. So I spoke to some of the attendants of the patients who are in the government hospital. They said that the situation, there was a shortage of oxygen sometime last week, but now things are easing a bit. Also, what has happened is that the Ram Janambhoomi Temple Trust, so they have set up a oxygen plant inside this medical college, the government medical college. So they now have a steady flow of oxygen. So which is enough right now to meet the demand. But again, like the DM said, DM told me that if the numbers keep increasing, then they would be in a sticky situation.
So who has set up this oxygen plant? The Ram Janmabhoomi Trust.
So they gave money from the Ram Janambhoomi Trust, basically gave the money to set up the plant. It was set up by a private operator and it's running right now. It has become operational 2 days back.
Okay, that's good news, Moushumi. And Sumanta has a question. The question is the Ram Mandir construction still going on?
Yeah, it's still going on, Jyoti. I visited Karseva Kudam, where they have kept all the pillars and the structures, some of the pillars and the stones that are being carved there. So they are saying that right now there are about 150 to 150, around 150 people who are still there working inside the area where the new Ram temple is coming up. But nobody can go there because it's under, there is a huge security cover out there. But all social distancing norms, all COVID protocols are being very, very strictly followed there. Nobody from outside is allowed to enter there. And there are workers there, but they have been following all the COVID protocols. That's what the Ram Janam Bhoomi Trust members told me at the Karsevakuram some time back.
Okay. Kishan is asking, Moushumi, what is the situation of vaccines? He wants to know both in Ayodhya as well as generally in Uttar Pradesh. And especially he's asking, today, he's saying today the third phase has started. I don't know if he's talking about the 18 plus age group, where everybody over 18 years of age is now can be vaccinated from today, the 1st of May. So perhaps if you can just tell us a little bit generally about the situation of the vaccination campaign.
In Ayodhya, Jyoti, I didn't see much of vaccination happening today, neither of people in the 18 plus age bracket or in the 45 plus age bracket. And the officials are telling me that, vaccination is happening in a very limited number because there is a shortage of vaccine. So once they get their supply, it would start. Overall, in Lucknow also, Jyoti, the state government yesterday announced that the vaccination would start for people above 18 years from today. But I mean, some of the private hospitals are saying that have been saying that it would be difficult because they don't have adequate supply of vaccines.
So, just to come back to your earlier answer on the holy sages and how the district magistrate was able to convince them to shut down Ayodhya. But was there any conversation that you had with Mr. Anup Jha about people returning from the Kumbh Mela?
Yeah, I did. So he said that, see, they had followed, basically, they had put up centers where they were registering all those people who are returning from Kumbh. And once they knew that the number of returnees, so the district administration was tracking them, as in if they showed any symptoms or if they are
They
falling
were
ill or
tracking
anything.
everybody who returned from the Kumbh Mela?
So they did that initially, but at a later stage, they did not maintain when the numbers started spiking in Ayodhya. Then they did not maintain the register anymore. So I mean, he was saying that, I mean, there have not been many fatalities from among those who have returned from Kumbh. There has been one sant, one seer from one of the main mutts in Ayodhya who passed away. But other than that, all these seers who have returned from after taking the holy dip in Ayodhya, there have been no COVID cases and or fatalities among them. However, I was talking to some of the workers in the Kar Sevak Puram. So they said that, Ayodhya is dotted with all these chhawnis, Maniram chhawni, then there are all these akharas, so where all these seers live. So they said that there were some 10 to 12 cases of COVID that were detected in these various chhawnis, and there have been 6 to 7 deaths. But now, the numbers, there are not many COVID cases out there, and there are no deaths also.
So it's interesting that they are talking to you so openly, Moushumi. I would have thought that they didn't know what COVID was, but obviously there is so much talk about it. All the TV channels on all social media, the
In fact,
newspapers.
Jyoti, the awareness among the people here, especially among the people in the religious community, all these seers, all these sadhus, mahatmas, I mean,
Yeah.
it's far more than what I encountered in even in some of the villages of UP. I
Mhm.
mean, these saints are telling me, these seers are telling me that, the fear, I mean, the fear psychosis has got into the people. So now they are themselves, taking all the precautions. They are alert. They on their own, keep indoors. They don't open their shops. They are not coming outside their house unless and until it's required. So they are saying that it's the administration didn't have to do much this time. The people themselves, because they kept seeing on the TV screens, they kept reading about the situation in the other parts of the country. They saw how people are dying without getting oxygen, without getting beds. So they because of all that, they have themselves become very alert, and the district administration didn't have to do that kind of awareness campaign like last time.
That's really interesting, Moushumi. So how do they talk about it? Do they call it a Mahamari? Do they use the word COVID? What do they say?
they are saying that बहुत ही भयावह ये है, बहुत ही भयावह रोग है, और लोगों को पता अब ये लग गया है, क्योंकि वो टीवी देखते हैं, वो ये देख रहे हैं कि ये खाली बुखार नहीं है, लोगों का सांस फूल रहा है, लोगों को हार्ट अटैक हो रहा है, तो लोगों में बहुत ज्यादा डर है. In fact, the district magistrate also told me that once the cases started spiking across UP and in Ayodhya also initially, so what they did was they had they held review meetings, and they met all, I mean, people, all stakeholders, the sane people from the saints, the shopkeepers in the markets, and then the district administration told them that these are the measures you need to take. This is how this time the corona situation is serious compared to last time, and they have to take all the precautions necessary.
What about the vaccination? Have these sadhus been vaccinated? Are they willing to be vaccinated?
Yeah, so interestingly, this seer that I interviewed, he is from the Maniram Akhara, and he got his first vaccination shot some 20 days back, and he's saying that the Maniram Chowni has already contacted the district administration for the second dose of their vaccine. He said that in his Chowni, there are some 1,000 workers right now. See, it has hostels. It has, I mean, people have been given different kind of work. So some 1,000 people live there. So around 40% of them who qualified, who are in that age bracket, have got their first shot of vaccine. So there is no vaccine hesitancy as such among the saint community in Ayodhya.
That is really fascinating, Moushumi. I have only a couple more questions for you and then I'll let you go. Rahul is asking that Yogi Adityanath, the chief minister, had said that all those who are spreading rumors about COVID, their properties will be seized by the state. Now, do you think that this has had an impact? Are people angry about it, or do they feel that this is an attempt to control the conversation around COVID? Is it an attempt to repress conversation or to talk about it? What is the reaction to this?
Jyoti, in the places that I traveled, in Allahabad, in Gorakhpur, in Kanpur, I spoke to a lot of people, but right now they are so distraught about what they are seeing in their areas, that nobody is actually interested about whose property is getting seized or not getting seized. When you are seeing so many dead bodies, you are seeing, I mean, your next door, I mean, so many of your loved ones dying because of COVID. So they are saying that they are not bothered about what whose property the government is seizing or not seizing. They want better health infrastructure. They want more beds in their hospital. They want more oxygen supply so that people don't die gasping for breath. That is the main thing. And there is a lot of anger among the people about the huge mismanagement by the government. So in Kanpur, for instance, Jyoti, where I was day before yesterday, I went to this Bhairav Ghat. So where some 73 bodies were cremated day before yesterday. So the people were angry. They are saying that there is no semblance of any governance here. They didn't see anybody from the district administration there, nobody from the municipal corporation's office. There were hardly any politicians around. So there was a lot of anger among the people. So seizing of property
The
of
secondary
those who are,
question.
yeah. So it was, I mean, that was not there in their,
Yeah. So when
mind
they
at the
when
time.
they express this anger, what do they say? Do they say that district magistrate को होना चाहिए था या local government से किसी MLA को यहाँ पे पधारना चाहिए था, हमारे दुख में शामिल होना चाहिए था? What is it that they're talking about? Do they talk about the?
They're saying that some elected representative should have been there in times of calamity. That is when, where are the elected members? Where are the MPs? Where are the MLAs? All of them have shut themselves inside their house. Why is nobody standing here with us? There is so much mismanagement. Cremation is supposed to be free. The Yogi Adityanath government announced that all the COVID deaths would be cremated for free. But you go and visit the crematoriums, and the staff there, the workers there are charging for each and every single service. So they are saying that there's so much chaos, so much mismanagement. And the sad part is that nobody from the administration, nobody from the government is there. There's hardly any governance you see there.
Right, Moushumi, that was a really heartrending report that you have just brought to us from Kanpur. In contrast, Ayodhya seems to be a little bit better, primarily because the district magistrate, Mr. Jha, seems to be much more involved. And it's fascinating what you just told us about the sadhus and how they're willing to be vaccinated, and their awareness about the COVID seems to be quite high. You were watching iWitness. This is the Print's daily live COVID feature covering the coronavirus pandemic. Moushumi, thank you so much for your time. And I'm sure that we will come to you in the days to come. Thanks again.